Hi, my name's Desiree, and in this video I'll be going over the male and the female reproductive organs. First off, we will start with male. Just ignore the picture down here, and that's part of the female. So this would be just like if we had a side view of the, inside the male, so like if we cut them right in half. So this structure right here, for reference, here is your rectum. Here's the urinary bladder. Urinary bladder has the urethra right here. And it leads out the penis. And then on the penis, we have the prepuce. And this head part is called the glans penis. We also have the corpus cavernosum, which is kind of right in here, and then the cavernous spongiosum, which is kind of here surrounding the urethra. We have the testes right there, and then what encases it is called the scrotum. On the testes, we have the epididymis, which leads off into the vas deferens or the ductus deferens. It comes around by the urinary bladder, and then right below the urinary bladder, that would be our seminal vesicle. We have that kind of just has more things that kind of just lubricate the sperm to come through. So then we have the ejaculatory duct, which passes through the prostate gland, which is underneath the urinary bladder, and right underneath that is called the bulbourethral gland. And so they come in through the ejaculatory duct and then get released through the urethra as well. I feel like I'm missing something. With the rectum, obviously we have the anus. And that is it on the male reproductive part. So on the females, I drew this is just reproductive, nothing else. What a female anatomy would look like. So in this one, we have the ovaries, the ovarian ligament that kind of just, because we don't want our ovaries free. I guess the best word I'm looking for is just bouncing all over the place in our body. So we have that to keep it attached. And then we have on the ovaries the fallopian tubes, what's called fimbriae. And they're like finger-like projections that kind of just sweep over the ovary and try to get and catch the egg that the ovaries release, and then bring it through into the uterus. The uterus has different lining, changing depending what part of your cycle you're in. What protects the uterus, I guess, and what protects the baby when you are pregnant is called the cervix. It is just that muscle there that keeps it closed so not a lot can enter into the uterus. And then what leads to outside the body is called the vagina. Better picture of just what the female anatomy would look like. I have this picture as well. So again, cut right down the middle. Just for reference, our rectum and anus are back here. Again, not that big. Then right here, that is our vagina. The cervix is right there, leading this to be our uterus. We have that fallopian tube there with the fimbriae and the ovaries. Down here is our urinary bladder. It would have ureters, and I forgot to mention that on the other one. With the urinary bladder, we do have the ureters coming off and up into the kidneys. And here is our urethra. And then on a female, that would be our pubic symphysis. And again, males have this too. It's just more easily seen in a female because there's not a reproductive organ coming off of that. It is all just right there. So, but underneath it, we have the clitoris, which kind of corresponds to the penis of a male. And then with what kind of protects our urethra and our vagina and are the labia minora and the labia majora, kind of just encases, like I said, the vagina and the urethra, kind of protects bacteria getting up there that we don't want to. As you can see here, one of the differences of like why women would get more UTIs than a male, because like you could see in females, urethra and the rectum are very close together. Also, we have a shorter urethra, so we don't have as much chance to like say if we do urinate, our urine is technically sterile. So we don't have as long as a urethra to kind of protect us like we would if we were male, and you have that longer urethra, so it's harder for bacteria to travel up that and get into our bladder. Again, harder, not impossible. Also, we need to talk about some of the different hormones that our bodies have. So in males, what controls our the hormones would be the testes. So testosterone gets released from the testes. And how testosterone is released and how it's also inhibited is through a negative feedback system. So an increase in testosterone concentration inhibits the hypothalamus and the stimulation of the anterior pituitary gland to release gonadic or GnRH. So that means that level is lowered. So that means that the pituitary gland secretion of luteinizing hormone, or LH, goes down as well, which decreases the amount of testosterone release. So testosterone secretion is decreased. When our body's blood concentration of testosterone is decreased and lower, the hypothalamus becomes less inhibited and once again stimulates that anterior pituitary gland to release the luteinizing hormone. The luteinizing hormone secretion causes the interstitial cells to release more testosterone, which leads to an increased testosterone concentration within the body of a male. And then in females, the main organs responsible for the hormones would be the ovaries. So ovaries in females release the estrogen and the progesterone. Estrogen is used to stimulate the enlargement of reproductive organs, which includes the vagina, the uterus, the uterine tubes, the ovaries, and the external structures as well. That's like your labia minora, majora, and the clitoris. Progesterone promotes changes in the uterine lining during the cycle of menstruation, so it just increases and decreases that lining depending on what day you're in. And then it also will affect your mammary glands and then help regulate the secretion of the gonadotropin from the anterior pituitary gland. Thank you.